Hello friends, I am a student at the Universidad Católica Santiago de Guayaquil. My name is José Antonio Barragán and my topic is Gene Therapy Platform for Correction of Anemia in End-Stage Renal Disease and my three social networks. Definition: anemia is a frequent complication in chronic kidney disease which precisely increases glomerular filtration. The precise treatment is many cases from stage 3 and 4. It is usually of the normocytic and normochromic type, with a normal reticulocyte count and well tolerated until advanced stage of CKD.
Kidney have a function to produce a hormone called erythropoietin, which is a protein that promotes red blood cell production. When renal function failed, the hormone cannot be produced adequately. So the bone marrow cannot produce red blood cell as needed.
Application in medicine. The specific treatment of renal anemia is use of ESAs in association with adequate iron therapy, without forgetting to compensate for possible nutrition deficits that may appear as a result of dietary restrictions, anorexia and losses on dialysis.
Your body is made up of 3 types of blood cells: white to fight infection, platelets to help clot, and red to carry oxygen.
Anemia is a term that doctors use when there is few red blood cells in the blood. Red blood cells carry oxygen.
To produce red blood cells, your body needs iron, vitamin B12, folate, and nutrients. Lacking in any one of these could cause anemia.
It could be a serious problem.
Doctors use a blood test to determine if a patient is anemic. The most common type of anemia is iron deficiency.
The causes are like heavy periods in women or any kind of like blood loss, acute or chronic. It could be like gastrointestinal. When people take medication, they have some kind of gastritis, or like colon polyps can cause those.
Patients who are iron deficient may need to stop or start a medication, begin taking iron pills, or have a blood transfusion to get their red blood cell count back up to normal.
Some people can have symptoms, mostly like that can happen when you have iron deficiency anemia, like you feel fatigue, very weak going up and down the stairs, sometimes short of breath. Like for example, with hemolytic anemia, you can have like skin discoloration, like jaundice, that we call jaundice, or right upper quadrant pain.
Patients should talk to their doctor about checking their red blood cell count if they are experiencing symptoms. For Lee Health, I'm Lindsay Fry.
Pros and cons. Anemia after treatment is associated with cardiovascular benefits such as decreased left ventricular mass and decreased cardiac output, along with a lower incidence of angina, episodes of congestive heart failure, and hospital admissions. The most notable effect is the anaphylactic reactions, although its frequency is very rare with the new preparations. Negative effects that are associated with the ability for iron to generate free radicals and lipid peroxidation.
Anemia in chronic kidney disease is a potentially serious medical condition in which patients have low levels of hemoglobin, a protein that carries oxygen to cells throughout the body. Millions of CKD patients in China and the U.S. experience this condition. For severe CKD patients, their anemia can increase the risk of heart disease, stroke, and hospitalization. We asked 1,000 CKD patients about their perceptions and experiences of anemia in CKD. Patients in our survey found that anemia in CKD has a big impact on daily life for patients, including feelings of sadness. In both the U.S. and China, many of the patients surveyed are also unaware of what common symptoms to look out for, including headaches and difficulty breathing. Discussing and tracking hemoglobin levels is an important aspect of disease management. But our survey found that many patients need more support to understand their hemoglobin levels, and patients would like more information. So, what if we started having more conversations about the potentially serious risks of anemia in CKD? Those patients we surveyed who felt more confident were more likely to be informed by their healthcare professional of the symptoms, impact on daily life, and severity and impact of anemia in CKD if left untreated. CKD patients should feel supported to take a more active role in managing their anemia. At AstraZeneca, we put patients first. We are committed to listening to the patient voice to improve outcomes.
Issue applied in Ecuador. The treatment is followed in Ecuador as in any part of the world. It is a very effective iron deficiency therapy to treat this type of kidney patients. In conclusion, it can be determined that the therapy against anemia is a good option in patients in terminal stage of chronic nephritis associated with death, reducing the mortality rate excellently. Thank you very much.